Good afternoon, everyone. Bon après-midi, tout le monde. I'm here with Brent Roussin, Manitoba's Chief Provincial Public Health Officer, for our Monday briefing. Je suis ici aujourd'hui avec le médecin hygiéniste en chef du Manitoba, Dr. Brent Roussin. Brent, over to you.
Well, thanks, Mr. Good afternoon. The current 5-day test positivity rate is 1.78%. With 38 new cases of COVID-19 being identified as of 9:30 a.m. Today. 4 other cases have been removed from the list. This brings the total number of lab-confirmed positive and probable positive cases in Manitoba to 731. There are 11 current hospitalizations, including 3 individuals in intensive care. 232 active cases and 490 individuals are listed as recovered. The number of deaths due to COVID-19 is 9, as we announced over the weekend, and we send our condolences to the family and friends of that individual. One case announced today is from a personal care home in Southern Health, Bethesda Place. An outbreak has been declared based on that one case. And investigations continue, and we don't have further details at this time to share. Preliminary testing numbers show an additional 1,716 lab tests performed on Sunday, bringing our total number of tests to 115,963. Again, reminding Manitobans to only present for testing if you have symptoms, even if they're mild, to get tested as soon as possible, but only if you have these symptoms. Of course, unless you've been directed to be tested by a healthcare provider. We know there's limited value in asymptomatic testing for the most part, and certainly we want to ensure we're using our testing capacity in an efficient manner. To help facilitate testing and verify your identification, please bring your Manitoba health card with you. If you're visiting from out of province, please provide that health card for. Many of our preliminary investigations indicate that the majority of today's cases in Prairie Mountain Health and Southern Health are linked to known clusters. Case investigations are ongoing, and additional information will be shared as that becomes available. Some updates in the clusters. So the Brandon cluster currently sits at 64 cases. We had previously reported this as 67, but after further investigation, a few of them we weren't able to directly link to that cluster. There are 56 cases connected to a place of business in Brandon, and still have not seen evidence of workplace transmission, although we're watching that situation very closely. There are 24 cases that are both connected to the Brandon cluster as well as that place of business in Brandon. We know in Southern Health, many of today's cases are linked to known previously existing clusters. Winnipeg, we have many cases that are linked to known cases, but we are seeing in Prairie Mountain region and in the Winnipeg region evidence of community-based transmission as well, so cases that we are unable to link to known cases or clusters. We're advising another potential exposure to COVID-19, and this occurred on August 5th to 7th from 7 a.m. to 3 p.m. at the 7-Eleven, 3360 Victoria Street in Brandon. The risk of transmission is considered low, but information is being provided to inform Manitobans. And so these possible exposures serve as a reminder to self-isolate as soon as symptoms develop, even if they're very mild. Go for testing. And that means staying at home and for the most part avoiding others in your home as well. Again, people who are symptomatic, we need you to stay home. We need employers to work with their employees to ensure that this occurs. We definitely are all in this together, so we all have to do our part to minimize symptomatic people out in the population. On the note of employers, again, another role is to avoid sending employees that are asymptomatic for testing. If they were contacts of cases, they'll be self-isolating. If public health is aware, if they're symptomatic, certainly do not allow your employees to be back at work and encourage testing. But because of our high test numbers, we want to reserve that for symptomatic people for the most part. So don't insist on asymptomatic employees providing test results. And we continue to mention the fundamentals. We've seen case numbers that we haven't seen since the beginning of the pandemic. We're seeing some evidence of community-based transmission, and with that brings anxiety to Manitobans. But to alleviate some of that is we all know what we can do. We can all make changes today. If we hadn't been focusing on those fundamentals now, we can certainly start today. And we all know what those are. To stay home when you're ill, even mildly ill. And this is paramount, and this is a huge change. We realize that. But it is paramount, especially as we move into respiratory virus season. Practice good hygiene, do not share items with others. And then a term we've come to get used to, physical distancing. That's 6 feet, 2 meters away from others when we're outside of our household. Limit our attendance at crowded places, indoor places. And then again, as we're seeing more cases come, as we've had some opening to our economy, we're increasing the messaging on mask use. So we've always, we've said as of late, that wearing a mask in circumstances where you can't physically distance. And that really means now is when you're not absolutely sure you can physically distance. So in indoor public places where you're not certain that you can physically distance, we're recommending you wear masks. It's an additional measure. It doesn't replace those fundamentals that we spoke about, but it's an additional measure that we can all take to limit the transmission of this virus. Self-assessment and symptoms of COVID-19 can be found by visiting our website, manitoba.ca/COVID-19. Again, mention the issue of stigma. Again, that impairs public health's ability to address this pandemic. There's no place for stigma or shame in our pandemic plan. So please keep that in mind as we move forward, as we see increasing cases, that we need people to be forthcoming with public health, people to feel safe to be tested, and to provide information to public health, and stigma impairs all of that. So thanks again to all Manitobans, and we can open up for some questions.
Minister Friesen, there's been a lot of blowback on the government's advertising campaign, the Restart Manitoba campaign. It seems to focus more on the economy than the health. Is the government thinking of refocusing that message given the rising numbers? Is the Restart Manitoba campaign going to be focusing more on health?
I thank you for the question. I don't completely support the premise. I do believe that the messaging is right. As Dr. Russon has continued to say, we have to learn how to live with COVID-19. And I think that what this campaign is doing is reminding people that they have to do the right things in order for Manitoba to continue to be a success story. But we do want people to make that shift, to get back to work, to get back to normal, whatever normal looks like.
Dr. Russon, is there any thought being given, you've probably heard of some of the first feelings by some school boards that they feel stuck, they don't feel they can mandate mask use because the province is not doing it. Given the rising numbers, are you rethinking, willing to reconsider the mandatory use of masks in schools?
Yeah, so I mean, nothing's ever been off the table for us, so we're certainly always re-looking at the plans. We want to ensure Manitobans are confident. You know, as any step of our reopening, we rely on the confidence of Manitobans to see that. So we'll continue to look at that. You know, any measure we make is there to, you know, increase the likelihood, you know, of compliance, and so we've highly recommended it. We don't have an indication that won't result in high compliance, and if we're ever concerned that we're not getting the compliance we need, then we can always mandate it.
Dr. Russin, how many staff are isolating at the Cesta Place Care Home in Steinbach?
I don't know the number on the staff, so we have a number of precautions at these work sites. So we have universal PPE, and in these in the nursing homes, in the personal care homes. So it's very likely that there are no staff that are required to self-isolate because they wouldn't be considered contacts.
We've had quite a bit of a lockdown on the care homes, and Manitoba has avoided the problems of other provinces. In the investigation so far, how did this one happen?
Yeah, it's an important question, and we're investigating right now. We definitely want to see where the contact may have come from, what are the risks on there. So certainly the care home responded quite quickly and quite appropriately to a symptomatic individual. They immediately had that person in isolation. They immediately isolated wings of that personal care home, and tested very early. And as soon as public health got the test, now we're investigating on just how that could have happened.
And the individual that passed away on the weekend, I know you don't give a lot of personal, is this person that we knew had the illness and was hospitalized? Is this a,
Yes, this person was hospitalized at the time.
what else can you tell us about that particular case?
Other than the age, in the 80s decade, not a whole bunch is relevant there.
Dr. Russin, when it comes to cohorts in schools, there's a lot of after-school programs that have kids from different schools, which would involve kids from different cohorts getting together. How is the province monitoring those cohorts, and would you look at coordinating those after-school programs to make sure you're not having any crossover there?
Yeah, and so when we're looking at the having those cohorts, that's the whole idea there is to limit the overall number of people you're in contact with, both to reduce the chances of infection, but also to limit widespread transmission as well as ease of contact investigation. So anytime there are increasing cohorts, it does jeopardize that type of strategy. So we have to review. I don't really have any information on the specifics of that, but those are type of things that have to be taken in consideration when we're doing this.
Were you expecting to see this day-to-day increase at this point right now, the daily double-digit cases? And if so, where is this trend taking us?
Yeah, so I don't, we knew that we weren't done with this virus, so we had that nice stretch, and we'll take it. But we knew that we're in a pandemic, and that's not was going to be in store for our future. I think that most of us in public health were definitely expecting numbers like this, and possibly worse in the fall respiratory virus season. I think we were. Doing our planning based on probably a more mild summer. But that's what this virus is like. If you get a couple clusters, it can spread quickly.
Dr. Russin, last week, I've asked repeatedly on what indicators are we going to get to that are going to actually trigger more restriction? You've stated nothing specific, but you will tell us, give us a more clear advance warning about what will dial things back. We now have the third highest active cases per capita in Canada, after only Alberta and Quebec. At what point, with the hospitalizations, with the positivity rate, with the R0, at what point does the thing that you say you don't want to do, there's more restrictions, what triggers that?
Yeah, and so there's more to come on our communication tool, and that's this week. We'll get something out, and I think it'll be a real good way for Manitobans to see our current status, as also some ideas on what could happen in the future with numbers. But I've mentioned a number of the things that we look at, and again, it's the nature of it is that we can't give a specific number that will do something, but we know the test positivity rate is something we report on, the non-epi-link cases, those cases that we can't link to known clusters or to other cases, and then measures of our healthcare system capacity as well are common, yeah.
From an epidemiological perspective, is it not safe to assume that because our test positivity rate is so much higher now, while we're testing so much more, that we have a much more serious situation than we had in late March, when the last time the positivity was so great, but we were really just focused at that point on returning travelers?
Well, I mean, it's tough to say that. If you look at, say, our hospitalization rate right now is lower than what we saw at that time. So it's hard to make conclusions about that. We know that the hospitalization rate sometimes has a lag. So we have a number of active cases, so sometimes there's a lag by the time for those people to get sick enough to get in hospital. But if you look at, say, the hospitalization rate in that first few months, we saw across Canada that 10 to 12% of people in hospital, and we're not seeing that at this point. But it is all, things that we're watching.
Is the cluster in Brandon, has that sort of peaked based on the numbers we're looking at now? And speaking of clusters, can you tell us what is going on in Niverville, Ridgeville? Because that's a small population, small area, and comparatively, those are large numbers there.
So the Brandon cluster, it's too early to say that we've peaked. Often we can't say we peaked until we look back at it. So I wouldn't say we've peaked in Brandon. We're certainly doing the typical cluster investigation that we do, widespread testing, and that includes widespread asymptomatic testing of people involved in that cluster. In the other district that you mentioned, this is a site of a cluster, and because of our our approach to minimize identification at this point, but that is a site of where we see a significant cluster there.
There's over 20 cases in a small area, small population.
Yes.
Is this some people who traveled and didn't?
Well, we're not seeing community-based transmission in there. This is a enclosed cluster, a tight cluster that we're seeing right now. So. No, I wouldn't. I don't know if I have the details exactly on what the index started at, but it's not widespread. It's not community-based transmission. It is a localized cluster.
Is it a colony?
It's a localized cluster.
In your modeling, how many students and teachers and staff do you expect to get COVID-19?
Like in numbers, well, there's really no way to come up with some sort of number. We see that COVID is in our communities. And so we see people test positive for COVID in all walks of life. So we have to expect to see positive tests in schools as well. And so we're setting up our response to be able to identify things quickly. We're not going to want to see symptomatic people where we know that that's the most highly transmissible area. And so we're going to limit the impact by it.
So there's no specific modeling done for schools in Manitoba? Is that?
Yeah, that would be really tough to model. That it wouldn't give us the information that we would come up with. I don't know how we could really come up with a useful number based on that.
If we still get 30, 40 cases a day every day up until the beginning of school, is school really going to start on the 8th of September?
Well, I mean, it's a good question. And like I said, nothing is ever off the table, right? We're always looking at the best way to approach this. We're looking at, we've been focused a lot on our steps towards, if we see a case in schools, what we'll do. But we also have to look at what's going around outside of the schools. And if we see large areas of community-based transmission, province-wide or even in certain locations, then we may have to think about how we approach that, and it may differ our approach.
Dr. Russin, there's a new poll out today that says 1 in 5 Canadians are making little to no effort to reduce the spread of COVID-19. What's your reaction to that, and given our rising numbers, is that reflective of what's happening in Manitoba?
Well, I don't know about the number. I think it's a good message that we've been dealing with this virus for quite some time, and Manitobans really stepped up and put a lot of effort, a lot of difficulties at the beginning. And I think that stretch in the summer where we had very reasonable numbers, it can be very understandable for people to lose track of those fundamentals. But we see these numbers now is that we're not done. And so if that is 1 in 5, then we're going to keep messaging, keep trying to work to try to get that 1 in 5 to take this as serious as it is.
Thank you, Doctor. We are now going to the reporters on the telephone, starting with CTV and Michael.
Hi there, Mr. and Dr. Russon. So in light of the cases today, and mostly in the Prairie Mountain region, and some polling that was done to suggest that rural areas or people in rural areas are less are less inclined to follow COVID-19 health precautions, will the province focus its messaging on more rural areas?
So, I think that at the beginning of the pandemic, we saw that 2/3 of our cases were related to Winnipeg early on, and so we didn't see the impact in the rural areas. So again, dealing with this for quite some time and the effort that everyone put in, it's understandable where we might lose track of it. But I think our messaging is going province-wide, including those rural areas, that we need to take this seriously, that we need to get back to those fundamentals. And then our approach going forward is going to be more that targeted approach, that if more direction is required in certain areas, then we certainly have the ability to do that.
And you're calling on businesses to essentially make sure that any symptomatic workers don't go into an office and they self-quarantine and the like, but why not just mandate mask wearing for businesses to ensure that the spread of the virus doesn't occur in workplaces?
So there's two separate aspects of that question. And so the one, absolutely, yes. I think that all Manitobans have a role to play. An employer's role to play is to ensure that sick employees aren't in the public. And so definitely encourage that. The other thing is about masks, and the way you phrase it is one of the concerns we have with masks is that it doesn't replace people who aren't ill going out and about. And so it's not a replacement for that. So we absolutely need people who are ill to stay home. In addition to that, masks are a very important thing to use in certain circumstances, indoor places where you can't be absolutely sure that you can socially distance, but it's not a replacement for those fundamentals.
From City News, Jonas.
Good afternoon, gentlemen. Dr. Russon, as the political discussion around masks made this more of a hot-button issue than it needs to be for you guys? I mean, if you went with a straight direction and said, the doctors say this will help, but the fact that it's already been so politicized and folks are so against it, is that part of the issue as well?
Well, I think the issue is that with any public health intervention, we always move to the least restrictive means and increase as necessary. So we've had some messaging out there about wearing masks in certain circumstances. As we see these numbers, we're broadening that message, and we'll see what type of adherence we get to. If we continue to see poor uptake, continue to see numbers being going up, then we might have to move to things like mandating, at least in certain circumstances. But right now we've got our messages out. Manitobans have shown in the past that they're willing to step up to prevent the spread of COVID, and we're going to expect that here too.
For parents that are watching these numbers tick up, and concerned about their kids and concerned about school and concerned about maybe a little more info in their pockets before they send the kids back, is there any way we can assure them that they're going to have a little more information on community spread or where things are happening before the kids go back?
Well, so right now I think that our information is pretty robust. We've broken down the cases now in the health district. So it's really have that geographic pinpoint now. As far as cases go in schools, we're definitely going to be keeping Manitobans informed about that. We will be, on top of those cases, have a lot of protocols in place, but we'll be informing Manitobans definitely of cases in schools.
From the Brandon Sun, Kyle.
Hello, Dr. Russin. I was wondering if you could elaborate at all on the potential exposure that occurred at the 7-Eleven in Brandon. Was this an employee or a customer or anything like that?
Well, for information like that, that's really to the public, we will give the information that's needed. So we said the time and the dates of the potential exposure. So that's what's required. We can say that there is symptoms involved at this, and that's why we made that mention to this is a reminder to be home when you're ill, and also for employees, for businesses to ensure that people with visible symptoms aren't in their premises. We know that we mentioned going for testing as soon as possible, so you might notice the ability of delay in announcing it, and a lot of that had to do with a delay in testing. So just a few take-home messages. The risk to the public is quite low, and it's in the past for the most part now, but there was a lot of messages there that we could share.
So it's not that there was a confirmed case discovered there?
Yes, yeah, that's why we mention it. So that's the exposure event during those times was when a confirmed case was during the infectious period at that time.
From CJOB, Diana.
Good afternoon, Dr. Russon, Diana from 680 CJOB. With regards to schools, I'm wondering how isolation and contact tracing would work within cohorts, say in a school with younger children who might not be able to kind of track who they came into contact with in their cohort. I know you have said it is really case-by-case basis should someone become infected with COVID-19 in school, but can you give an example of what might happen in different scenarios, say one where the impact is relatively minimal and another where maybe more people are impacted? What would that look like?
Yeah, so if we had a case in a certain class that was well cohorted, then we would do our case investigation. We would look at the period of infectiousness, and we would expect that this would be during the period of infectiousness, but not symptomatic, because we're not going to have symptomatic people in our classes. We would look and see if we really could find close contacts, people seated in desks surrounding them, for instance. But if we couldn't be sure about that, then it may be the entire cohort that would be self-isolating for that 14 days. So it really depends on the circumstances. Probably as we get older children, we'll be able to be more sure about the contact investigation. But the idea behind a cohort is that it shouldn't expand beyond that cohort. That we self-isolate all close contacts, but it shouldn't be necessary to have anyone self-isolating who isn't part of that cohort.
Okay, thank you. And then as a follow-up, we are hearing that there may be some employees at the Bimplot plant in Portage-la-Prairie who tested positive. Obviously, you've talked previously about the business in Brandon. Are you able to confirm that there is sort of a cluster in workplace in Portage, or are there any businesses in the Southern Health region that are seeing clusters?
I don't have any information on that.
From the Winnipeg Sun, Scott.
Good afternoon. I guess a question for Dr. Russin. The message has been, Manitobans are expected to step up. Some at least anecdotally seem to perceive that the government's not doing the same at this time, maybe as the same as it was earlier on in the pandemic, and just taking other precautions like mandatory masks. So I guess the question is, why expect Manitobans to step up when perhaps some perceive the government's not doing the same?
Yeah, and so we've acted early in this pandemic. We still have restrictions in place. There are still public health orders in place, but they have significant ramifications, and going back and forth with them has significant ramifications. So if we look at certain, businesses or any aspects of the economy that can't rely on the ability to be open, that every time we see a cluster of cases, we're going to shut things down again, is going to be unworkable. So what we want is Manitobans to make informed choices, to be able to use the information we provide them to act accordingly in these times. If necessary, we do have that ability to impose further public health restrictions, but we've learned so much about this virus. We've lived with this virus now for many months, and I think that we should be able to deal with this virus without widespread restrictions.
And my follow-up is, I guess, along the same lines, but for parents with children going back to school, given that test positivity rate is going up, or it has been going up, the hospitalizations are up again, active caseloads are up, cases continue to rise. Why should parents feel confident sending their kids back to school in a few weeks?
Well, I think seeing these numbers now, of course, brings out a lot of anxiety in many Manitobans. We had that time in the early summer where we were at almost zero active cases. And so seeing these numbers again is a reminder, and certainly I can understand some anxiety. But we balance that with the importance of getting kids back in school. We balance that with the multi-layered approach to safety that we have in school. And we continue to follow things. When we're making these plans early on, these plans are months in the making, and things change over that time, and things have changed over just a couple weeks' time. So we'll continue to do what we can, but certainly the safety of children and safety of the teachers and all the staff is paramount. Absolutely.
From CBC Radio Canada, Gavin. From CBC Radio Canada, Gavin. From the Niverville Citizen, Sarah.
Thank you. Dr. Russon, with the noticeable leap in cases specific to the Niverville area, is it possible to clarify for me again on the traceability of the cases? Are they all accounted for?
Yeah, so those cases are related to a current cluster.
Okay, and just to help our small community in this time, could you comment on a possible provincial rapid response strategy? Is there one being implemented for Niverville specifically at this time? And do you recommend anything else for the town to do, such as reverting back to phase 2? I know we're not using phases anymore, but as a small community with a spike in numbers, what are your recommendations for the town, for businesses, mask wearing, etc.?
Yeah, and so we don't have any immediate plans for any of these rapid response. Certainly our approach to that we're going to be discussing later on this week as a province-wide approach. But I would say that, again, these numbers are anxiety-provoking, but we all have that ability right now to dramatically reduce our risk, and that's those fundamentals. Right, so staying home if you're ill, washing your hands frequently, physical distancing, and in those indoor public places, wearing a mask.
We'll try one more time for Gavin at CBC Radio Canada. Okay, back to the news conference theater for questions from the floor.
Are any current clusters related to religious services?
Religious services, I don't believe we have any current clusters or cases that can link back to transmission within a religious service at this point.
Dr. Brewson, yes or no? Does Manitoba now consider trucking-related cases to be travel?
Trucking-related
COVID-19 cases.
If they were a case from outside of the jurisdiction that we felt they acquired it there, yes, we would determine that as a travel base.
And Minister Friesen, how much money will the province spend on ventilation, HVAC upgrades in Manitoba schools? Ontario is doing a big, crazy, quick program. What are we doing?
So I don't have that number for you right now, but I can tell you that the kinds of interventions that are being contemplated for schools are significant. I know that everyone is very hard at work behind the scenes. And as Dr. Roussin clearly said, there is every effort being made to make sure that students and teachers and staff can go back in safety.
Dr. Roussin, you said earlier that the children, the close contacts of the cluster in Brandon were tested, and there were some of the positive cases. Do you know how many of those children were asymptomatic who tested positive in the cluster?
Yeah, I don't have that number. Yeah, so we usually do our Case investigation and close contacts will usually offer them testing at 5 days after their last exposure. And unless they're symptomatic, then we test them at that point. But I don't know which the proportion that were asymptomatic.
Just getting back to the ventilation, forgive me, because we've seen this become suddenly a very big issue. Since last week, when the schools plan was announced, we know many schools some of their windows don't even open. Some of them are very old systems. Some can't simply add more outside air as is recommended in the education plan. So given the fact that opening windows is not an option even at all here in January, or maybe it is, I don't know, is there going to be an update soon, prior to the school year, on ventilation that can be shared?
Well, I would say that I know that Minister Gertsen has had a number of updates here, and he's indicated it will not be the last. I believe there are a number of meetings, including telephone town halls, that are taking place this week, and that information continues to be received, opinions continue to be heard, and plans continue to be made. So I would say that you can look forward to additional updates. However, I would also hearken back to what Dr. Russin said, and that is that ventilation needs to be considered for sure. But the fundamentals, even when it comes to school, will be very, very important. When mask wearing is in place, where desks are located, how entering and exiting spaces will be observed, how partitions will be put up. Those things will be the most effective kinds of interventions we can have in schools to stop the spread of the virus.
Dr. Russin, can you name one concrete downside to not mandating masks in schools?
The downside is just using the other than the least restrictive means, right? So it's we have a mandate there. When we come with a mandate, then there are some people that are unable to wear masks. Often it will become sometimes stigmatizing to those people. But yeah, I mean, I think that we certainly can. It's certainly something that is not off the table, but we have strongly recommended. We don't have any indication that that's not going to result in good compliance, and if it does, then we have that option.
Minister Friesen, do you have any update on what's happening with the auxiliary space in personal care homes that was being planned for the fall?
Yeah, I can provide a quick update. As Manitobans know, one of the most difficult things we did was to close personal care homes, of course, to visits. We worked hard to make sure that we could get visits back in place, and even a few weeks ago, we moved to the declaration in phase 4 of allowing 2 family members or persons related to a resident to be deemed essential or to be deemed like a caregiver, so they could come and go with more freedoms. That's all good, but we know that we must plan not only for the now, but we have to plan about what's going to happen in November and February. And that's why we have embarked on a significant initiative to create either outdoor or interior shelters at personal care homes that would facilitate careful and safe visits between residents and their loved ones should we see a spike, should we see a rise in cases into the fall and winter. I can tell you that the RFP process has completed, and that we will be awarding, that every effort is being made to make sure these companies know that speed matters, and they will be held accountable not only for what they can create, but how they can marshal the solution to the site, get it working, and we plan to be there to support the personal care homes as well as they move to allow these spaces to be used to help visits take place.
Dr. Russin, with the case at a personal care home, there's one confirmed case and an outbreak has been declared. Can you just explain why you would declare an outbreak with the one case?
Yeah, just because of the severity. So we have a confirmed case of this. You know, usually in, say, an influenza season, we'll usually acquire more than one case on it. But because of the severity of COVID, because of what we've seen in other jurisdictions on how quick this can transmit, that it's just an abundance of caution to declare an outbreak where a lot of protocols are immediately put in place, albeit a lot of that already was in place in these areas, but it was just our decision to declare an outbreak immediately.
Couple more? No? Okay, thank you.
Thank you for your time, both of you. Thank you.